Ash for giving the opportunity to present our data at this press conference. As already mentioned, breakthrough in the mortality rate and also the death rate is especially also in patients who were vaccinated with hematological diseases very high, and especially also in Europe we have more and more breakthrough infection in this patient cohort, but also in the total population, especially in persons who were full vaccinated early this year. There is a time-dependent reduction of antibody titers, and we have demonstrated several studies that patients with hematological diseases have lower antibody titers after vaccination, especially patients with lymphoid diseases or patients under rituximab therapy. So far, little data are available for patients with myeloid neoplasms and on the effect of vaccination. So we have done an observational single-center study in our hospital between July and October this year, and measured the antibody levels against the receptor binding domain of the SARS-CoV spike protein. And this was taken positive in the case of a range of 0.8 and more of units per milliliter, when also the antibody against the nucleocapsid antigen N were negative. We used this Roche system with a measurement range of 0.5 to 250 units per milliliter. In total, we have investigated 373 patients with a median age of 64. Female patients were 44%. Vaccination was performed mainly with the vaccine from BioNTech in 77% of patients, but also Moderna, AstraZeneca, around 10% of patients. And as it was the rule in Germany, at the beginning we had a mixture of vaccination with the AstraZeneca ChAdOx vaccine, and second with the BioNTech in 6% of patients. In our cohort, 56 patients had no seroconservations. They showed no positive antibodies in below 0.8 units per milliliter, but especially also a substantial number of patients had lower levels of 250 in between 0.8 and 50, and also between 50 and 250 units per milliliter. Negative anti-response was associated with disease type, especially here with the indolent and aggressive lymphomas, but also with MDS, and in MPN patients, a substantial amount of patients had a negative seroconversion. Also patients with multiple myeloma. Patients with CML had nearly no negative results, which is an exclusion in this hematological patient cohort. Vaccination response and therapy, there was an association between, for patients with MPN who were treated with ruxolitinib. In 5 of 6 patients who were treated with this JAK2 inhibitor, we haven't found a positive vaccination response. Also in indolent lymphoma, ibrutinib, acalabrutinib, rituximab, and immunoglobulins were associated with negative response. Also in aggressive lymphoma, 5 of 8 patients had a negative response when they were especially on active treatment. In the MDS patients, we couldn't find a correlation to a specific therapy. So in summary, a remarkable group of patients with hematological diseases had no or low immune response after a second COVID vaccination. Therapies associated with low response were rituximab, ibrutinib, acalabrutinib, and ruxolitinib. An exemption were patients with CML, where nearly 90% of patients had a positive seroconversion. With that, I'd like to thank you for your attention.
Thank you so much, Dr. Saussele.